Welcome to this informative video on the dobutamine stress test, a chemically induced cardiac stress test that plays a crucial role in assessing heart function, particularly in patients who cannot undergo a traditional exercise stress test. In this video, we'll cover the key indications for this test and how it helps in managing various heart conditions. First, let's talk about the diagnosis of coronary artery disease, or CAD. The dobutamine stress test is used to detect ischemia, identifying areas of the heart muscle that do not receive adequate blood flow under stress. This is essential for diagnosing significant coronary artery blockages. Additionally, in patients with chest pain of uncertain origin, this test helps determine whether the pain is related to CAD. Next, we have the assessment of cardiac function. The dobutamine stress test evaluates the heart's pumping ability, known as ejection fraction, and detects any abnormalities in the heart's wall motion that may suggest underlying heart disease. For patients with heart failure, the test assesses how well the heart is functioning and helps differentiate between ischemic and non-ischemic causes of heart failure. Preoperative cardiac risk assessment is another critical indication for this test. It is used to evaluate the risk of cardiac complications in patients undergoing major non-cardiac surgery, especially those who cannot perform an exercise stress test. This is particularly relevant for patients with multiple cardiovascular risk factors or known heart disease. The test also plays a vital role in evaluating valvular heart disease. It helps assess how well heart valves function under stress and is used to determine the severity of conditions like aortic stenosis, mitral regurgitation, and mitral stenosis. In surgical planning, it can be part of the preoperative assessment to determine the need for valve surgery by evaluating the impact of valve disease on the heart's function during stress. For patients who experience unexplained shortness of breath, fatigue, or other symptoms during physical activity but cannot exercise due to physical limitations, the dobutamine stress test helps determine if these symptoms are related to heart disease. In patients who have had a heart attack, the test is valuable for assessing the viability of the heart muscle and the extent of damage, guiding further treatment decisions. It's also used to monitor known coronary artery disease, helping to track disease progression and assess the effectiveness of treatment. After procedures like angioplasty or coronary artery bypass surgery, the test can evaluate the success of these interventions and detect any recurrence of ischemia. Finally, the dobutamine stress test is useful in evaluating exercise-induced arrhythmias. It helps assess the presence and impact of arrhythmias that may occur during physical stress, particularly in patients who have experienced palpitations or fainting. The dobutamine stress test is a valuable tool, especially for patients who are unable to undergo traditional exercise stress testing. It provides critical information for the diagnosis, risk assessment, and management of various heart conditions, ensuring that patients receive the most appropriate care. Thank you for watching. If you think the dobutamine stress test might be right for you, or if you have concerns about your heart health, be sure to consult your healthcare provider.